that is the cortical bone. Okay. So there is one nomenclature called C1, C2, C3. Okay. So what is C1 and C2? There is one good article in Google itself. You can find it out. This crestal cortical, no? Can you see this is little bit white? This is white, very opaque. Okay. This is the crestal bone. Usually it is good cortical, you can see here also, right? Okay. Sometimes it is good, sometimes it is very thin. So that is called C1. Crestal cortical is called C1. What is C2? This cortical bone. Okay, the nasal floor. This is the nasomaxillary buttress. That means between the sinus and between the nose there is one, this part. Okay, that is the, this part is the buttress. Okay, that is the cortical C2. So this is C1, sorry C2, this is another C2. The anterior sinus wall, that is yet another cortical bone. You can place implant touching, no? Yes. Touching here. You will get good cortical support than here, no? You will get. Okay, the anterior maxillary sinus wall. This is another C2. The sinus floor is also a C2. You can see, no? It is thick. But of course, sometimes it is weak. See, this is the sinus floor here. This is another C2. Okay. The posterior wall is another C2. Okay. One more C2 is available in the maxilla, which we cannot see in this section, which can only see in this section, the palatal bone. Okay. So how many C2 is available? Nasal floor, buttress, anterior sinus wall, floor, posterior sinus wall, and palatal bone behind the central incisors, behind the incisors. So what is C3? Outside the maxilla and mandible. Outside the maxilla and mandible. The pterygoid. Pterygoid doesn't belong to maxilla. It is a part of which bone? Sphenoid bone. Okay. Which forms the base of the skull. Okay. Any example for C2? Sorry, C3. Outside maxilla and mandible we are taking support. Zygoma. Okay. So C3 is pterygoid and zygoma. Out of this pterygoid we should know. Pterygoid. Zygoma, leave it now. As of now. Okay, pterygoid is important. So out of C1, C2 and C3, C3 only pterygoid we are taking. We are leaving the zygoma now. C2 we should know because this is the area we are playing. Even if you are placing conventional implant, you should know. Nowadays, conventional implant is also going till C2. C1 is crestal cortical, it is not very much important. The conventional implantology is more focused in C1. How to build graft, how to put bone graft, GPR. Right, crestal part, how to manage. But when it comes to basal, this is the more C2 and pterygoid is the more important part. So, how many implants for maxilla? Different concepts are used in different parts of the world. All on 4, somebody will tell, all on 6, somebody will tell. How we do with single piece we will discuss. Okay. What is the number of implants is determined. Okay. 8. Tentatively we are planning with 8. One important rule to remember is place more number of implants if the opposing jaw is natural tooth. If the opposing jaw is natural tooth, the risk is more because the patient is going to give more force because it is a natural dentition. So whenever the opposing tooth, especially the mandible, is natural tooth, give sufficient number of implant. So usually we do with 6, but now we do 8 also. So how to location now? Where to place it? 4 this side, 4 this side. Okay. Out of this, 1, 1, 2, 1 are the important key areas. Okay, 1, 1 and 2, 1 anteriorly. Okay. place one implant in the 1-1 region and another implant in the 2-1 region. And second premolar is another key area, second premolar. Okay, here and somewhat here. Okay. So out of 4, 2 implants we placed. Another 2 implants is there. In between, 1 implant we have to place here, and distal support you need to place 1. So in the molar area, the palatal socket I will be placing another one, and 1 more implant either in the canine or lateral or in between lateral and canine. Because it is an ortho case, the anatomy is somewhat disturbed because the premolar is extracted and everything is okay. See, it is canine here, it is first molar, but here instead of 2 premolars only. So the anatomy will be little bit challenging in ortho patients. So our plan is to place implant in this ear. See, here lot of option is there. You can place implant in canine, you can implant in the lateral or in between. Okay, so 4 implants here. Here. Okay, coming to this side, here definitely you can place 1 implant, right? In the palatal socket also you can place 1 implant here. Okay. And in between these 2, in front of the second premolar, you can place 1 here. 1, 2, 3, 4. This I place in the 7 region actually, because lower 7 is present. So I am placing 1 implant in the 7. So 4 plus 1. This side 7 is not there. So full mouth case you can divide into 2 categories by seeing the X-ray. Ideal case, no difficult case, no very complex case. This comes under very ideal case, ideal for beginners. You have got good bone in the molars, you have got good bone in the anterior, left side, right side, everything. Imagine there is no bone here, the sinus has come down here. Imagine the sinus is coming down here. You can place implant only in the second premolar. Then you have to place pterygoid there. Or you can give 1 tooth as cantilever. Okay. So these are the challenges, but this is an ideal situation. That is why we are placing implant in the molar area. But many times there is no bone in the molar, right? The sinus is expanded or there is crestal bone loss. By seeing the panoramic X-ray, you are making one simple plan. That is the beginning stage of the plan. So out of this plan, right side 4 implant, left side 5 implant. Even you can place 1 more implant in the 7 region. 5 plus 5. Considering she is young, below, she is below 40 years. She must be below 40 years. Next 40 years, she may live possibly. So till that 40 years, she has to take up the road. So don't compromise on the number of implants. Okay. So that is why it is better to tell always the package. So whatever implant is necessary, you put it. Don't try to save money on the number of implants. Okay. So from this view, this is the panoramic view. So whatever planning we did, it is a panoramic view. But there is one more view from the other side. Okay. So recently I went for a course. They showed this picture to know the importance, difference between 2D and 3D. So that is why the importance of 3D is must. So now we have planned with the panoramic view. Now we will see the other dimension.